We're here for the global launch of the International Narcotics Control Board annual report for 2022. And allow me immediately to pass the floor to the President of the International Narcotics Control Board, Madam Jagjit Pavadia. So please, without further ado, the floor is yours.
Thank you, Mr. Nisirki. I'm pleased to welcome all of you to this launch of the 2022 annual report of the International Narcotics Control Board. INCB's annual report presents an overview of the global drug control situation and makes recommendations to governments and international and regional organizations on how to better implement the provisions of the treaties. The 2022 annual report is accompanied by a supplementary report, No Patient Left Behind, Progress in Ensuring Adequate Access to Internationally Controlled Substances for Medical and Scientific Purposes. The INCB Precursors Report covers action taken by governments and INCB to prevent the diversion of chemicals to illicit drug production by implementing Article 12 of the 1988 Convention against illicit traffic in narcotic drugs and psychotropic substances. A growing number of states, in Chapter 1 of our report, we have shown that a growing number of states have adopted policies that permit the use of cannabis for non-medical purposes. This contravenes the drug control conventions, which require that drug use be limited to medical and scientific purposes. The number of states having legalized such cannabis use is still relatively small, but a number of governments are considering pursuing policies in this direction in the future. The 1961 Single Convention on Narcotic Drugs classifies cannabis as highly addictive and liable to abuse and is therefore included in Schedule 1. It is the role of the World Health Organization to assess the need for any changes to the scheduling of internationally controlled substances. States parties to the conventions need to remain within the consensus established by the majority of the members of the Commission on Narcotic Drugs. Current challenges include the shift to a more globalized form of production, increased indoor cultivation, new methods of production, and improved extraction techniques leading to increased potency. Health risks are associated with increased potency of cannabis products, such as edibles and vaping products, as well as synthetic cannabinoids. The expanding cannabis industry has contributed to the normalization and trivialization of cannabis use, as well as reduced perceptions of harm. Policy and legislative developments related to cannabis use and control also include the recognition of drug use as a health issue, measures to reduce adverse consequences of drug use, medical cannabis programs, decriminalization, and depenalization. The rationale behind legalization related to unintended consequences of strict approaches to drug control, protection of health, particularly of young people, organized crime, human rights, stigma, disproportionate impacts of law enforcement and judicial responses, and potential tax revenue. The convention-based system offers significant flexibility for states to protect young people, improve public health, avoid unnecessary incarceration, and address illicit markets and related criminality. Three elements are key to this approach: the principle of proportionality, the establishment of better education, prevention, and law enforcement. Decriminalization and depenalization can be consistent with the conventions as long as the limits set by the conventions are met, limiting the use of drugs to medical and scientific purposes. The impact of legalization is challenging to measure and encompasses cannabis consumption, public health, the illicit cannabis market, and the economy. Large corporations are expanding into the cannabis industry and have lobbied for lifting controls on cannabis to broaden commercial profits. Legalization has not been successful in meeting the objectives stated by the respective governments. In particular, legalization has not been successful in dissuading young people from using cannabis and illicit markets persist. Cannabis-based products are being marketed in ways that appeal to young people, and the perceptions of harms associated with cannabis are declining, despite the high potency of products and related health concerns. The trend of legalizing the non-medical use of cannabis represents a significant challenge for the international community, particularly for state parties to the conventions which have chosen to support that cannabis use be limited to medical and scientific purposes. We go to the first global issue, the growing threat posed by a surge in illicit cocaine production and trafficking. A surge in illicit cocaine production and trafficking poses a growing threat to public health. There has been an unprecedented increase in coca bush cultivation and the manufacture of cocaine in recent years. Changes in related criminal activity have led to an intense increase in the secondary extraction of cocaine in Europe. As a result, there is a larger quantity of purer product available at cheaper prices to consumers. INCB urges coordinated action by governments targeting each element in the supply chain to address underlying causes of increased cultivation, manufacture, trafficking, and consumption, as well as appropriate precursor control, government partnerships with private sector stakeholders, and disruption of related illicit financial flows. Globally, there is increasing misuse of emerging non-fentanyl opioids which are not under international control. In 2022, INCB issued 7 global alerts, special notices related to non-fentanyl opioids. 3 of these non-fentanyl opioids were reviewed by the WHO Expert Committee on Drug Dependence, which recommended to the Commission on Narcotic Drugs to add the substances to Schedule 1 of 1961 Single Convention on Narcotic Drugs. This will be under consideration of the Commission next week at its 66th session. Mental health has been included in the Sustainable Development Goals, which has helped to increase global awareness about the issue in recent years. However, investments in the supply of the necessary services have not matched the demand of the population affected by mental health conditions. WHO data show that at least 3/4 of the world's population with mental, neurological, and substance use disorders live in low and middle income countries where mental health services are scarce and often difficult to access, and access to prescribed medicines for the treatment of such conditions is mostly inadequate. In addition, the many humanitarian crises resulting from armed conflict, climate change, or public health emergencies have had a major impact on people's mental health in all parts of the world. At the same time, there is a growing concern in many countries over overprescription and self-medication. Monitoring global availability of psychotropic substances for treatment of mental, neurological, and substance use disorders remains a challenge due to lack of consumption data collection in many countries. INCB is reminding governments of the need to ensure that those living with mental health challenges are provided with appropriate access to adequate treatment and medications to alleviate their suffering. This should also extend to emergency situations. Just a few highlights from our regional analysis. Cocaine trafficking remains a major challenge for countries in North and West Africa. Similarly, trafficking and use of cannabis and tramadol is a challenge for many countries in the African subcontinent. Several countries in Central America and the Caribbean reported seizures of large amounts of cocaine, indicative of surges in drug trafficking following the easing of mobility restrictions. The drug overdose epidemic has worsened in Canada and the United States due to the illicit manufacture of and trafficking in synthetic opioids in North America. In the Amazon region in Brazil and Peru, drug trafficking organizations have expanded their influence, diversifying their activities to include environmental crimes. This has been linked with an increase in murder rates targeting indigenous populations and environmentalists. In Colombia, coca cultivation and potential cocaine production reached a record high in 2021. In East and Southeast Asia, illicit manufacture, trafficking, and use of methamphetamine continue to pose a serious threat to peace, stability, and public health. Illicit markets continue to expand, with record amounts of the substance being seized. Significant seizures of methamphetamine are trafficked from Southeast Asia to South Asia. Concerning West Asia, INCB expresses its solidarity with the people of Syria and Turkey following the devastating earthquakes last month. INCB has reminded governments of the possibility of using simplified procedures to expedite the movement of internationally controlled medicines to the affected areas. Afghanistan remains the largest source of illicit opium in the world, accounting for an estimated 86% of global production of illicit opium in 2021. Also, methamphetamine production increased significantly in the country. INCB is calling upon the international community to continue to support drug control efforts in Afghanistan to protect public health. INCB stresses the importance of strengthening Afghanistan's capacities in providing treatment and rehabilitation services to people who use drugs, particularly women. In Europe, most illicit drug-related activities have rebounded to pre-pandemic levels, with a greater availability of drugs with increased potency and lower prices. Cocaine trafficking is increasing in Europe. INCB remains concerned about the humanitarian crisis in the Ukraine and calls for unimpeded access to medications, including those containing internationally controlled substances. Many communities in the Pacific region are being challenged by the increased use of drugs, in particular methamphetamine, and the activities of organized criminal groups. This is a spillover effect of growing drug trafficking through Pacific Island states, which continue to be used as transit areas for drug trafficking to Australia and New Zealand. Trafficking in fentanyl and other dangerous opioids is expanding to markets in Oceania. This is demonstrated by a record seizure of fentanyl made in Australia and the detection of emerging non-medical synthetic opioids in New Zealand. Recommendations. The INCB's recommendations to governments and international and regional organizations are contained in Chapter 4 of the annual report. Many of the issues have already been covered in my presentation. I would like to briefly emphasize 3 points. The fundamental goal of the International Drug Control Treaties is to safeguard the health and well-being of humankind. This requires full respect for and protection of human rights, including due process of law. All drug control policies and actions should conform with international human rights obligations. Many countries still lack mechanisms for gathering information on drug use and treatment demand. This hinders efforts to develop targeted, evidence-based drug use prevention and treatment programs. INCB is encouraging countries to develop and strengthen systems for the collection of data on drug use trends and treatment demand. At the same time, INCB is encouraging countries to take action to reduce the stigma associated with drug use disorders and to implement programs to prevent drug use and to provide evidence-based treatment, rehabilitation, and social integration programs. INCB remains extremely concerned about ongoing large-scale opium poppy cultivation and opium production in Afghanistan. The political and socio-economic challenges faced by the people of Afghanistan is exacerbated by environmental and humanitarian emergencies, pose further obstacles to effective drug control in the country. INCB is calling upon the international community to continue to support drug control efforts in Afghanistan to protect public health, including for women as an important aspect of development assistance to the country. In 2022, INCB collected and analyzed information from member states and civil society to provide an update on the availability of controlled substances for medical use. This is a supplement to the 2022 annual report and is titled No Patient Left Behind, progress in ensuring adequate access to internationally controlled substances for medical and scientific purposes. Disparities between regions in the consumption of opioid analgesics for the treatment of pain persist. For psychotropic substances, the situation is less clear, but limited access and availability, particularly in low and middle income countries, also seems to be an issue. There was a steep increase in the global availability of opioids analgesics, with a decrease after 2018, mainly due to reduced reported consumption of strong opioids such as oxycodone and fentanyl, mainly in North America. Around 5.5 billion people still have limited or no access to medicines containing narcotic drugs such as codeine or morphine. 75% of the world population does not have access to proper pain relief treatment. Around 92% of the morphine used worldwide is consumed by only 17% of the world population, primarily living in the United States, Canada, Western Europe, Australia, and New Zealand. Many countries continue to report difficulties procuring medications containing morphine, although sufficient quantities of opiate raw materials are reported to be available. The problem is that much of the morphine available is being used to produce codeine, which in turn is mainly used for preparations such as cough syrups. Only a small amount of the available morphine is used directly for medical purposes such as palliative care. The limited amount of morphine used directly for pain relief is mostly used in high-income countries. The slide shows the impediments to availability as cited by governments. The analysis of the data reported by member states to INCB as well as government and civil society responses to an INCB survey in 2022 shows that there are still key areas requiring action by member states and the international community. For psychotropic substances, some key trends have emerged. Consumption of anti-epileptic drugs, including clonazepam and phenobarbital, are low in Africa, Asia, and Oceania relative to the Americas and Europe. Consumption of methadone and buprenorphine is concentrated in a limited number of countries. In some countries, despite the existence of injecting drug use, the consumption of buprenorphine and methadone and also the presence of opioid agonist therapy services are limited or not present at all. The delivery of controlled substances for medical care in emergency situations is sometimes problematic, including during the pandemic. The global supply chain of medicines was adversely affected as a result of both the disruption in the manufacturing of key starting materials and active pharmaceutical ingredients in some major manufacturing countries. Logistic challenges arising from border closures and other social distancing policies adopted by a number of countries also prolonged the delays. INCB is pleased to note that some progress has been made with several positive developments reported by countries in 2022. Of the countries that reported to the board, 60% had changed their national legislation in the past 5 years, and 45% had reviewed or changed administrative and regulatory mechanisms, declaring a positive impact of the new mechanisms on availability of controlled substances. These included specific changes relating to cancer treatment and palliative care, increasing the number of healthcare professionals who are allowed to prescribe controlled substances, measures to increase affordability of medicines, and the introduction of electronic measures to facilitate prescription and the procurement of controlled substances. Some countries also implemented low-cost, home-based palliative care services, which in some cases became partially or even fully integrated in the national healthcare systems and were funded by the governments. Now I turn to the Precursor Report 2022. INCB's Precursor Report for 2022 shows that the world precursor situation has never been more complex and dynamic. Following the recommendation of the board, the Commission on Narcotic Drug at its 65th session in March 2022 placed the precursors of the highly potent opioid fentanyl under international control. At the same time, there are now 67 countries and territories on all 5 continents that report seizures of precursors not under international control. No class of drugs remains untouched by this use of non-scheduled chemicals. In the last 8 years, 10 new substances, some of them designer precursors with no known legitimate use, have been added to Table 1 of the 1988 Convention. Seizures of chemicals used in the illicit manufacture of methamphetamine and heroin declined. However, alternative precursors, including designer precursors, are used to manufacture methamphetamine illicitly, and there are indications of use of alternative chemicals to manufacture heroin. Data also suggests the likely expansion of illicit manufacture of methamphetamines in new areas. Drug trafficking organizations are using new and sophisticated methods to smuggle cocaine base. 15 cocaine processing laboratories were discovered, and 6 of these were in Europe. Drug traffickers continue to exploit internet platforms to source precursor chemicals for illicit drug manufacture. INCB examines the role played by the internet-related industry, including internet and email service providers, social media, and business-to-business platforms in facilitating precursor trafficking, and makes practical recommendations for governments. Timely action on notifications for planned exports of precursors prevented the possible diversion of nearly 1 ton of pseudoephedrine preparations to illicit channels. INCB's PEN Online system facilitates these pre-export notifications. The INCB has launched a twin system called PEN Online Lite in October 22 to support governments in addressing suspicious trade in non-scheduled chemicals. Investigations have also benefited from real-time information sharing through the INCB Precursors Incident Communication System, PICS. INCB's Precursors Report makes recommendations to governments and international regional organizations. We are encouraging governments, international donors, and organizations and other relevant partners to build capacities and operational knowledge to prevent chemicals from being diverted into illicit drug manufacture. INCB encourages governments to monitor the internet surface web for suspicious postings regarding precursors and to investigate such postings with a view to disrupting internet-facilitated precursor trafficking. Governments have increasingly recognized the need to address equipment used in illicit drug manufacture and enhance operational use of Article 13 of the 1988 Convention. INCB has developed guidance materials and practical tools for use by governments and encouraged information sharing and cooperation to prevent and investigate cases of diversion and trafficking of equipment used in the drug manufacture. In October 2022, INCB met with member states on the subject and launched INCB's first technical report on equipment and Article 13. The INCB is supporting member states in their implementation of the conventions and in their pursuit of the Sustainable Development Goals. One important tool is the INCB Learning Program. Over 1,250 officials from 145 countries have enrolled in the e-learning modules available in English, French, Portuguese, and Spanish. And in 2022, INCB launched a 5th e-module to support governments in their efforts to ensure adequate availability of drugs for medical and scientific purposes. And finally, GRIDS. The INCB GRIDS program is supporting member states in their responses to the increasing movement of non-medical synthetic opioids and new psychoactive substances. It promotes the sharing of information by law enforcement authorities to prevent dangerous substances from reaching consumer markets. In 2022, a significant increase in real-time exchanges of trafficking information among law enforcement and regulatory authorities were recorded on INCB's Ionics platform. Exchanges on new psychoactive substances, NPS, and dangerous non-medical synthetic opioids have led directly to investigations and helped law enforcement dismantle organized crime groups in several countries. Over the past year, the INCB GRIDS program held 30 training events for more than 600 frontline officers. The training was led by regional technical officers based in Egypt, India, Mexico, Nigeria, and Thailand, and focused on the safe handling and control of opioids and information exchanges using the IONIX and GRIDS platforms. Within the framework of INCB cooperation agreements with the Oceania Customs Organization, the Universal Postal Union, the World Customs Organization, and most recently CARICOM impacts, targeted operational action is enhancing international efforts to identify new psychoactive substances trafficking hubs. An example of this is in 2021-2022, Operation GAPS, which involved law and regulatory enforcement focal points under INCB's Project ION and Opioids Project, and resulted in seizures. This brings me to the end of my presentation. I look forward to taking your questions. Thank you. Thank you, Mr. President.
Well, thank you very much indeed, Madam President. And the floor is open for questions. If you have them, please let us know and identify yourselves. Yes, please, Albert.
Thank you. My name is Albert Otti with DPA, German Press Agency. On cannabis, there is also a section on Germany and Germany's plans to legalize cannabis. In simple terms, what would your advice be to the German government in that regard?
I wouldn't give any direct advice to any government. You'll have to bear with me. I'm a board member. We have 13 board members. We are dealing with looking at the situation in the world and how the conventions are implemented. So I think the only advice I would say is that they should see that they're within the parameters of the conventions as it's laid down. And since cannabis is a Schedule I substance under the 1961 Convention, any move to legalize it for recreational purposes would go beyond the purpose of the 61 Convention. Thank you.
Thank you very much. Other questions? I can see one question here, please, and then we'll come to you. First of all, over here. Thank you.
Thank you. Sharif, Horn of Africa News Agency, Horn. My question, if there is any role for religions in the process of legalization. Thank you.
The role
Any role for the religions in the process of legalizations?
Thank you for the question. Actually, in the beginning in 1961, when the convention was formed, there were some provisions, interim provisions, where all these aspects relating to religious communities and local use of, say, opium or coca leaf, there was a 25-year thing for the thing to be adjusted. But no, there is no role at the moment in the conventions to give any exemption to any group of indigenous people or even of any product for that matter. Thank you.
Thank you. Please.
Peter Fritz, Austrian Television, ORF. Madam, are you aware of any efforts to change the 1961 convention? And it's been quite a long time. 61 happens to be the year that I was born by happenstance. So can this convention be changed? What would be the requirements for any changes? And would you support any changes as regards, for instance, cannabis use?
Thank you for the question. I think that the board doesn't have a role in recommending anything as such, because as you know, the conventions were approved by member states. 50% of the member states of the CND at that time approved this. And we have more than 186 countries who have, approved the convention. So having said that, if there's any change or if any change is to be brought about, any member state can bring the matter before the CND. And then after suitable debate, either it will be accepted or not accepted. And the next step is that after that, if it's not accepted, it can go to the ECOSOC. and then it'll go to the General Assembly. So there's a whole protocol for that, and then the Secretary General will indicate what are the changes sought to be brought about, and there's, I think, 18 months' time before countries can think about it, discuss it, debate it, and then have a vote. So it's a very long process. It's not easy to change any convention as such. Have I answered your question? Yes.
Short follow-up, would that require two-thirds majority or simple majority?
Are you talking about the amendment? I'm not very sure, but I think not. There must be special rules for that, especially when you're amending the convention completely. Yeah. Thank you.
Thank you very much.
Yes, thank you.
Please.
My name is Luis Lidón from the Spanish news agency EFE. The main problem that I find in this report is that when I see the press release is very conclusive, saying that legalization lead to higher consumption and to increase in risk for health and so on. But when I go down to the report, I don't see a systematic analysis that back that, because I see some data from the States, and I know that it's very complicated because, as you mentioned in the report, every country has a different model of regulation. But how do you go to this conclusive, to this conclusion that are very strong? And do you think that this is you did a correct analysis with the data that we have right now?
I think in the chapter 1 we have tried to make a balanced analysis, and we have indicated that there are constraints in coming to any solid conclusion about these things because of lack of data. That we have even in psychotropic substances. Countries are not reporting to us, so we don't know what is the consumption of psychotropic. Similarly, as far as cannabis consumption, etc., we are not getting reports from countries. So it is very difficult to come to us, but there are studies. The report has got referenced several studies which support these conclusions. Thank you. You want to say something else?
No, it's fine. Maybe I have a follow-up question. I think that Colombia and Bolivia are thinking to declassify the coca leaf. How would that process be, and how long would it take? Because I think that they have to propose to the CND, then it's going to be the World Health Organization who make a statement about that, and then it's going to be a vote in the CND at the end? Or how is the process exactly?
It's anybody's guess how long it would take, but it depends on how it is presented in the CND and whether there's a decision that it will be referred to ECDDA to give an assessment. So it's very complex, and actually the coca leaf itself is under control. I mean, it's a controlled substance. So that means taking it out of the schedule itself. So that would need detailed analysis by WHO and also the consent of all the CND members.
Of all of them?
Means whatever percentage, I think 50% have to agree. But the rescheduling takes time, then there'll be an analysis, and then the rescheduling will be presented by WHO, then there'll be a vote in the House. It may not be in one session, so to speak. It may take 1 or 2 years also. It's a highly complex subjects, yes. Thank you.
Thank you. Albert?
On Ukraine, you mentioned in the annual report the possibility of lowering the bureaucracy, of supplier countries to make it easier to export to Ukraine painkillers or mental health medications. But the report doesn't say anything whether there is actually a problem or a lack of supply. So can you say anything about the situation? Is there a gap in supply in Ukraine that needs to be filled? And if yes, how big is it?
We have not received any feedback of lack of medicines, but since the INCB's role is to facilitate the movement of controlled substances in any emergency situation, that is why we reiterate it again and again that there are simplified methods, and the customs are also, have issued simplified instructions about movement, because ultimately goods get stuck at customs points. So across countries, we're trying to smoothen that, and also suspending the need for an import authorization into that country. So far, we have not received any report of any problems, but we do get queries and we assist them in whatever the specific problem is. Yes, thank you.
Thank you. Please.
Yes.
I was in Africa in January, and in the sub-Sahara, there is a lot of uncontrolled military troops. Among them, also some European groups. I don't want to mention any name, but they are dealing with what I heard from my information. I mean, I have a very, very reliable information resource, so that they are dealing also with drugs. Have you any information about that cases? Thank you.
Personally, I have not heard anything of this issue, but if there is any information, please let us know. We can check it out because it's important if there's a particular area which is affected by drugs, and if there's some action to be taken vis-a-vis the government, that we can talk to them. Thank you.
We can follow up with you subsequently, Mr. Sharif. Thank you. Any other questions? I've also been checking the chat. There are no questions there. So thank you very much indeed.
Thank you.
And thank you very much for coming this morning. Thank you.
Thank you very much.